So welcome to the first edition of NurseVerse. This is a podcast powered by ESNO, that's the European Specialist Nurses Organisation. This is giving a voice to specialist nurses all across Europe. I am delighted for our first episode to be joined by Ber Oomen, the Executive Director of ESNO. Thank you for joining us today. Tell us a bit about ESNO.
Well, thank you for hosting me in this environment. And first of all, to be in Brussels. Well, I'm the executive director of the European Association for Specialist Nurses. And when I say director, I don't feel like a director. It's more like a person who is leading this great community of specialist nurses all over Europe.
So you see it more as a community than an association?
Yeah, of course. We, as an association, we act according to the rules and the regulations. We are in the Netherlands formally registered. We are obliged to meet the law of the Dutch regulation under and the associations. So we all cover the legal aspect, but also in Europe, like for example in the transparency registration. So that really makes this a very strong organization. But if you look at me, you walking, you don't see me as the typical director.
Right.
Yeah. What
is the message that you want to convey about specialist nurses?
Oh well, first of all, I think maybe everyone saw that during COVID. Maybe and here now we are in May 4 years ago. Everyone was locked up abroad, or locked up in their own house. Mm-hmm. We saw the ambulances. We saw the dramatic consequences. We saw intensive care nurses. We saw nurses in elderly homes. So we saw these nurses in all kind of specialties. And that's also an aspect what we see. They were seen as unique. We get applause, but then also we saw that there are ambulance nurses, and that's where we strongly were pushed just to look at this group of professionals. So, if our organization doesn't like to talk as the nurse we say that doesn't exist. So if we talk about nurses, is already in their specialty or in the health domain, for example, in pediatrics or in elderly or an operation room, or going into the ambulance in the helicopter. So you can't shift, for example, a nurse who's doing cardiac surgery on a newborn kid, going the next week to do orthopedics.
Right. So every nurse will have his specialty or her specialty, but is the issue that these specialties are not often recognized?
Absolutely, yeah. Maybe hard in mind, but if you're looking at, for example, recognized, we have a very different angle of understanding of what's recognition. If you take, for example, on recognition, you see, for example, the nurse in anesthesia, or in the ICU, or an operation room, or on oncology. Doing, for example, take for example a nurse, an expert in stem cell transplantation. They have an education. They have they follow guidelines. They do on expertise. What they do is highly valuable, because if you have cancer and you're going into the hospital on a stem cell transplantation, then you can see I was very good and very competent cared of during my therapeutic process, and the nurse was always there, and that's then only the nurse can say yes to that if the nurse is also confident in their activities. So if you're doing an intervention with a new medication, then the nurse wants to be comfortable. And that's where this specialty comes in.
Can you give me an idea of the landscape of specializations now? Is it the case that in some countries certain specializations will be recognized, in other countries not?
Yeah, I think the variety is really immense. So it really depends on the interest of a national government or a university or a series of hospitals where they say, well, we do recognize you. But if you take for the training in intensive care in, for example, Croatia, or in the Netherlands, or in Finland, or in Portugal, the education is extremely different. And that's because the nations have their own principles on budgets, on the facilitation, but also a lot of universities are not equipped to do this education. So it's immensely fragmented.
Yeah, I would imagine, if I'm an MEP, I can understand your position, but one question I would have is, what would you want me to do about this?
Support the nurses and the nursing organizations who are a member of ESNO in their outcry, and let's say, well, we have done our homework. We have curricula. We have guidelines. We are experts. We are bachelor's degrees, post-bachelor's degrees, academics. But why doesn't meet any European standard? So if you take, for example, the European, coming back to the nurse anesthetist who's doing a training in the Netherlands, why is it not the same as in Spain or in any other country?
So you think that all of this should be regulated at EU level?
At the end, yes. To meet also the quality of care, what we promise to the civil society. So you have this access to health, but it's very weird if you have a certain condition and you know that you have to go to another country for your treatment, and then your treatment is well executed. You go back to your home country, but there is no nurse in, for example, on the rheumatology or idiopathic pulmonary fibrosis, which is a highly advanced specialty. So I think we need to start somewhere the discussion on harmonization of specialties. And take, for example, those specialties which can be clustered in certain domains. Because, yes, we have 25 to 30 specializations, so it's very complex to have them all. But you need to have somehow the discussion. And we know that it's a very complex issue. And we have the European Directive on Professional Qualification. And there it needs to be revised. But we really see that it's more crucial just to have a good conversation on this, rather than the administrational institute in Brussels try to visualize what they think it's relevant. So you could go more towards the situation where you can say, well, we have a new mandate. We need to have a revision on the directives, but let's start this mandate. Just open a mechanism, just to discuss it, and then maybe in the next mandate setting the regulations. But as long as already when you start, then you have already a very positive outcome. But then you're starting discussions, then you're open.
Would there not be resistance to this at national level? And is that not where you should be directing your focus, in the sense that some countries won't want their regulation of nurses or of healthcare to be done from Brussels?
Yeah, I'm not a politician, so I'm looking at from the patient perspective and from the healthcare professionals perspective. So as long there is a movement into that direction, and you could take it, for example, under the umbrella of the European Health Union, I think there's already a certain mechanism where you can say, well, we also include that element. And also, what I also think is that we recently, a few years ago, we started with this new agency in Europe on the HERA, on the preparedness for new pandemics. So I think that it also needs to be included the healthcare professionals, and not only the technical instruments, because then you're talking about the economics. Then you're talking about sharing, but not the flesh and bones, who are at the end, who are driving the ambulance, who are stepping out into the home where a patient is. So that's.
Do you think that human lived experience of nursing is missed in the regulatory frameworks that exist today?
Yeah, that's also a bit of my learning over the past years, and that's also the beauty of this work here in this European environment. You're learning every day, yeah. And if I go to the Brussels environment, I also see that the regulations in the industry, everyone is learning. Oh, now there's something new popping up, and that's also about my learning. Mm-hmm. And yeah, you see, I'm also doing a lot of thinking. So and it's also sometimes I'm a bit of too much of a philosopher, that I say, well, what am I doing here? And it's so some people say, well, how do I get there? No, so why do I get there? Why do I get there? And the thing is that I think sometimes health is we need to have a better understanding on health, what we do. So sometimes I think in my exploration on making myself clear, then I think it's best just to take the example on the hardware and the software. If you take, for example, the health in the hardware, then I see the skeleton of our hospital. Then I see the entrance, I see the pharmacy, I see the beds, I see the intensive care. I see the healthcare professionals in their demand and the supply discussions. Their shortage. How do we demand? How do we supply? So this is the hardware. But if you're going to the software, then you're going to the nurse, looking into their eyes. Then you can say, I'm here now, working for 30 years here. I had another 20 years ago. What makes me really feel good? And that they say, well, what drives you here? And then what we see is that this part of the software is often taken for granted, but we do not know how to meet them. So we know they are very important. We like to applaud. We can't miss them. But then it's the how, and there are very clear indications how to meet the nurses' expectations or their wish. Why am I going to the hospital? The problems I'm going to see is not going to be very easy. I'm going to, for example, I'm a nurse in pediatrics. I'm going to the ward, and we see, for example, 3-4 new babies coming in with measles or whooping cough. You don't want to see a baby with extremely respiratory, you're breathing for air. And that's where you say, well, can I do this? And then the nurse will say that needs to have this feel, yes, I can do this. And at the end of the day, say, well, I did a great job. And that's the personality. That's where the education, where the trust comes in. So these are the
And you're saying that specialization will help with that.
The recognition. So if you're doing that, for example, this nurse in pediatrics, and I'm doing this now for 20 years. I still not recognized. I got my certificates, but if I go to another hospital or even abroad, then nothing is of any value. So then I have to start from scratch. My education, I have to climb the ladder from bottom up again. So it would be very instrumental if European Union, as a kind of inclusive health context, where we could say these nurses are recognized by their specialties, and that also makes them feel more proud, and also that they can work. They have the same qualifications in any other nations.
Based on your experience so far, would you say that politicians are receptive to your ideas? And for instance, is there any movement on this directive?
There should be movement, and everyone is talking about it, but we don't know how and not know why. And as you see, if you have this why clear, and you talk with these nurses and talk with the professionals and also with the patients, and then it becomes more clear why the revision of the professional qualifications should be amended, and where the specialist nurses or the nurses in the advanced nurse level are recognized in their status in the European context.
Presumably, the why is better patient care.
Yeah, then you got two motivated. Then you make a cross selection with two. So you got a patient who is motivated just to get better, and then you also have a professionals who is motivated. You say, because I can do my job.
But the impression I get is, in spite of this, revising the directive is not on the agenda.
I know it's a complex case. Well, in the last years or in this administration, we hear too often, well, it's not within our mandate. And then we refer too much to the subsidiarity principles. So now we have a new window of opportunity.
Can you explain that a bit more? So how does this get prevented by the subsidiarity principle?
Well, every nation is responsible for their own professionals, for their own health policies, and that can be, as I said, in the hardware, in the hospital care, but also to the healthcare professionals, and that's also well. There's a big window to look at these healthcare professionals. What at the moment is called as a big problem on the shortage, on the recruitment. So then you can say, well, don't make it a problem, but create it as an opportunity, and talk with these professionals, and don't imagine or don't go to the data, which often are 5 or 6 years old, but ask to these, and that's also where our organization likes to be instrumental on these domains.
So your first step is not necessarily let's revolutionize this directive and see can we find a way around the subsidiarity principle, but if you just had a mechanism that would allow policymakers to get the views of nurses, you'd be happy with that as a start.
Yeah, start. Open up the possibilities to create this new mechanism. Open that door, and don't close the door and say, well, this is it. Because if you're a patient in a hospital and you need something, and the nurse says, well, I cannot do this, but you need a pain relief, you need something done, then the nurse is going after it until you're comfortable. So we also need in health also this kind of new attitude. What can we do? How can we contribute? So because we all need each other on this.
How serious is the skills shortage in nursing nowadays in Europe?
It's immensely. I think it's very good you mentioned this, Paul, the skills. Sometimes people make this mistake between skills and education. Skills that is a quality what you learn over time. You're becoming skilled. But in our organization, we talk about the professional. So you can be, for example, a nurse in intensive care. That's a profession. You are doing this for 10, 20 years. But then your skills come in, for example, you're very good at doing blood samples. Your skills coming in intubation. So that's where the skills come in. So there's a big, there's this wonderful initiative on skills increasement, also skills. New skills development. Mm-hmm. I think that's really needed. But if you ask to our constituencies, then they say, well, it's not only about skills, it's really about the professionalism.
And that comes back to the main point of your association in the first place.
Yeah. And then that's almost the same voice as all the members, all the members see.
Yeah. What is the European House of Nursing?
It's a weird idea. It's a weird idea. Maybe
good.
Yeah. We have mixed reactions. We are dropping this idea sometimes here and there, and some are very resistant. So, oh no, we don't have to do this. No one can pay it. But the nurses say, well, I really like it. And the idea is that we as organization, we feel our limitations. You see, we are not representing all these nurses in their specialties. We are representing the members. And the members, some are very interested also to be active in this Brussels health ecosystem. And they want to be more confident, and they want to have their say personal. Because I cannot speak about dialysis, I cannot speak about rheumatism. That's where the specialist nurse organizations comes in. But we have also, for example, the advanced nurse practitioners on the eyes of this global organization. They recently created this European chapter, and according to our constitution, we cannot have them as a member. But we like to partner with them, and they want to do the same thing as us, as we do. But also, for example, the Sigma Theta Tau. This is a research group of nursing, and they also want to have their advice or their consultancy in Europe. And all these nurses organizations are really aspire to each other. So we meet them, but we meet each other on all congress.
So you need a forum. You need a location.
We need a location, maybe first virtual, but I think it would be very instrumental if these organizations are allied to each other, and they have to follow a house. They can be inspired to each other, but also the external world. For example, the European Commission, the agencies, they have a question. They don't have to make a choice. Shall I go to one organization or to another? But then they go to the house where there's a kind of a food market or a supermarket, and you say, okay, I can go there and I can pick my specialty. And if I'm talking about obesity, I'm going to the education, I'm going to the diabetes, and I create this. So this is the idea what we try to establish.
So you had a whole career in healthcare, and we spoke about skills development, but you've moved to a career, I would say, in something that you could call public affairs, association leadership. What skills have you learned in recent years in this new phase of your career?
Well, new skills, I think, being more curious, because what I learned is first that there was this is the world, this is the status, I have to work in. But now what I learned here in this environment, that every organization, that's also what organization says, it's not carved in marble. Its organization is fluid. It's always constantly developing. So what I learned, and that's what I liked, and just to be competent in this growing organization. You have new mandates. You have constantly new horizons. You have new elements coming in. Take, for example, the nurses organization on the climate change. they need to be also be included. If there's something, there was 1.5 year, I was invited to come to a meeting to say something bright about climate, nurses and climate. Well, we have great national initiatives of nursing organizations who are working on climate, and they need to be having a station in this house.
Yeah. Have you also focused on developing other resources within your organization, developing people so that you have enough people to really address the challenges facing nurses?
Yeah, and I think that a lot of nurses are now really in the phase of being aware that their leadership could make a difference, and that their leadership doesn't go only at the bedside, but it's also on ward level, on institutional level. And with our organization, we create opportunities for nurses also to be more active in this European environment.
Yeah. You also brought this recent publication with you. I see it in front of you now. Principles of Nursing in Kidney Care. I mean, how much of this type of research is linked to what you're doing at the association?
Well, it's also one of my big learnings. I'm proud to be a series editor of this series, and I had to read the full book, and I didn't realize what dialysis nurses in kidney care do.
Yep.
And it's really massively, it's very highly expertise. But this community is a very, very warm, strong community with a longer history than ESNO. And that's
what this is underlining is that the material is there already for all of these different specializations. It's not like that needs to be developed.
Yeah.
And you're continuing to promote that now in the organization.
Yeah, because we have this one on oncology, we have this on the mental health, we have now in process one on infection prevention, we have one on gastroenterology. So there's and there are even already much more. So the resources are there, the experts are there. But they need to be more recognized in the heart and mind of the politicians and by the regulators. So that only see, well, these are the nurses. No, the nurse. If you talk about the nurses, you talk about one of them, one of the members, and yeah, they really the nice book, the nice element on this book, Paul, is if you read it, you understand. They wrote it in such a way that you can say, "Oh my God, this is really interesting." I didn't realize that at the moment that each day 30,000 patients are depending on dialysis. I never realized that, but every liter of blood you need 200 clean water just to clean it, and that's a massive number of football swimming pools just to do this, and that's only one specialty. So and that's really makes me glad just to read the read and say, wow, this is such a fantastic profession.
Now, do you think that your members, or even members of your members, are keen and willing to promote themselves with the same type of passion and assertiveness that you bring to your work in Brussels?
Absolutely, yeah. Yeah, and maybe also we had this meeting the 10th of October in the European Parliament. That was the first meeting. We are going to have a second meeting, and where we're going to address the relevance of certification, harmonization, and recognition in the European Parliament. And a lot of members will be there, but it hasn't got any impact if the politicians will not be there. Or we need to have the regulators, but also with our colleague professionals, like from the medical, from the pharmaceutical domain, but also those who are in the decision position, like for example the OECD or the observatory. So we need to have a far more open discussion and very transparent narratives. And we all recognize we have our limitations. We're all modest. But if you have all these limitations and this modest together, you will be very much inspired by those who are working in Brussels.
So that's what you're talking about when you're talking about your community.
Yeah.
Okay. And that's what you see among your members and people getting inspired from other members to be able to really make the case for the value of specialist nurses.
Yeah. Yeah. And that's also for the professionals in the nursing domain. Yeah.
Okay. Ber, it's been an absolute pleasure talking to you today. Wonderfully insightful. This is the first episode, like I said, of NurseVerse, the new podcast for specialist nurses. Thank you for listening. And Ber, thank you for joining me today.
Well, thank you for your very wonderful questions, Paul.